when we look at graft-versus-host disease, there's both acute and chronic graft-versus-host disease. Acute GVHD, depending on things like the conditioning regimen, patient's age, GVHD prophylaxis, it can vary somewhat. But in general, I would say probably it's about 40 to 50% of people who get transplanted will have some form of acute graft-versus-host disease. As I mentioned, there are different things that can predict graft-versus-host disease, such as donor, the degree of HLA matching, et cetera. But I think that the most challenging thing is even if you take a perfectly matched donor undergoing a transplant, there's going to be half who will get it and half who won't. And above and beyond looking at donors, age, conditioning regimen, GVHD prophylaxis, there's not a lot else that we can do to predict. People have tried to look at numerous different markers to say, how can we predict who's going to get GVHD, who's going to have the best donor? But from the pre-transplant setting, there's not a lot we can do to predict it other than look at some of the things. Most of the things that we look at that predict graft-versus-host disease are not controllable either.